In this video, we'll see about complete abortion. Before seeing about complete abortion, let's have a quick recap about what all we have seen in our previous videos. Firstly, what is abortion? Definition: abortion is the termination of pregnancy by any means before the fetus becomes viable. Viability refers to the period from which the fetus can live independently. So this is abortion. And coming to the types of abortion, we have seen about threatened abortion, and then we have seen about inevitable abortion, incomplete abortion in our previous videos, and in this video we will see about complete abortion. In complete abortion, as the name suggests, complete refers to the entire products of conception or the entire ovum has been expelled out. Of the uterus. So in complete abortion, the entire products of conception or the entire ovum has been expelled out. Now coming to the clinical features, as in any other abortion, the clinical feature constitutes of a triad where there is a period of amenorrhea followed by bleeding per genum and abdominal pain. So there will be a history of amenorrhea, abdominal pain and bleeding per vaginum with passage of products of conception. So after these have been passed out, the pain and bleeding decreases. So these are the symptoms. Coming to the signs, on general examination, the patient is stable, and on abdominal examination, the uterine size is less than the period of gestation. This is because the products of conception have been passed out, so the uterine size decreases to less than the period of gestation. Next, on pervaginal examination, the cervical os is closed, uterus is small, and there is no significant bleeding. This is the pervaginum finding. Cervical os is closed, uterus is small, and there is no significant bleeding. And here the diagnosis is confirmed by ultrasound examination. This is about the complete abortion. The next type we will see about is the missed abortion. Here, as the name suggests, it is missed abortion. So, the symptoms of abortion initially occur, which includes amenorrhea, abdominal pain and bleeding per vaginum, but they later subside without the products of conception being expelled. This means that the products of conception or the ovum dies and is retained within the uterus. It doesn't come out. So this is missed abortion. The symptoms of abortion will occur, but after some time they subside without any products of conception being expelled. So here the products of conception die, but they are retained within the uterus without being expelled out. This is missed abortion. Now the clinical features of missed abortion, the symptoms include, as any other abortion, there is amenorrhea, with symptoms of pregnancy. Then there can be history of threatened abortion. This may or may not be present. Then coming to the signs, the uterus doesn't enlarge anymore, or it becomes smaller, and pervaginum examination shows bleeding which can be minimal or absent. Uterine size is smaller. The uterus doesn't enlarge further or it becomes smaller, and on pervaginal examination there is minimal or slight or even absent bleeding, and the uterine size is smaller than the period of gestation. Coming to the management, so in most of the cases missed abortion undergoes spontaneous termination of pregnancy. So if the missed abortion occurs early in pregnancy, then the entire contents of uterus change into a dark red or brownish mass, which is known as carneous mole. If the missed abortion occurs early during the pregnancy, the contents of uterus change into a dark red or brownish mass. This is called as carneous mole. So if the missed abortion occurs late in pregnancy, then it becomes a shriveled sac containing a macerated fetus. So if it occurs late, then there will be a shriveled sac containing a macerated fetus. And in this stage, the pregnancy test shows negative. And the diagnosis is confirmed by ultrasound examination. So now coming to the specific management, in many cases all the missed abortions will be spontaneously terminated and eventually expelled, but there may be a delay. If this delay occurs, there is a risk of developing coagulation disorders, if the dead fetus is retained for more than 5 to 6 weeks. So now coming to the management, if the uterus size is less than 10 weeks of gestation, then evacuation can be done using medical methods. Like misoprostol tablets, (600 to 800 micrograms) inserted vaginally. This is the medical method of abortion. Also, the manual vacuum aspiration can be done as a surgical alternative. And in case of Rh negative mother, we should give anti-D prophylaxis after performing these abortion. So this is about the missed abortion. In missed abortion, there will be symptoms of abortion present, but later they subside without the products of conception being expelled. The product of conception or the ovum dies, but it is retained within the uterus. They are not expelled out. And then the clinical features, symptoms and signs. Management: in most cases, missed abortion undergoes spontaneous termination. If it occurs early in pregnancy, then there is formation of carneous mole. Then if it is occur late in pregnancy, then it becomes a shriveled sac containing a macerated fetus. In this stage, the pregnancy test shows negative. Diagnosis, as in every other case, is by ultrasound examination. Specific management: all missed abortions will eventually be expelled, but there can be a delay. If this delay occurs, there is a risk of coagulation disorders. So the product of conception should be evacuated less than 5 to 6 weeks. If it exceeds 5 to 6 weeks, then there is a risk of coagulation disorders. If the uterus size is less than 10 weeks of gestation, then we can perform evacuation by medical methods, which include misoprostol tablets 600 to 800 micrograms inserted vaginally, and a surgical alternative to this is manual vacuum aspiration. So this is about the complete abortion and missed abortion. Thank you.